Hi, everybody. To be totally transparent, this is my first in-person speaking engagement since, I think, February 2020, so I'm not totally sure if I still know how to do it or not, but I'll sure give it a shot. So thank you all so much for having me, and I want to say it is such an honor to be here with a group of like-minded individuals who are so focused and so dedicated to getting ahead of the curve and to really being proactive instead of reactive to some of the things that we have seen building up and that some of the things that we know are coming in our communities. So I'm very, very thankful to be here. So on March 6th, 2020, was when I had got the direction, hey, I think you all remember this, hey, we're gonna go home for a couple weeks, flatten the curve, and then we'll be back. With the information that we had at that time, that's what we thought we were going to do. And 2 weeks turned into a month, and then a month turned into 2 months, and it just kept going and going and going and going. And within that first couple of weeks, we started to understand, I think this is going to be a longer, more serious situation than maybe we originally thought. And so within my role, and just to kind of explain what my role is, I'm as mentioned, the Chief of Staff at the Division of Mental Health and Addiction. And so under my purview is the mental health and substance use disorder treatment across the state of Indiana. And then above that, I have the larger umbrella of the Family and Social Services Administration. And so basically what we do is we have dedicated our lives and our careers to helping the people that need it most. And so when we started to sniff out that this pandemic was going to be probably more serious than we thought initially, we immediately started thinking and working, who is going to be the most disproportionately impacted by this pandemic? Who are the people that if the resources that they have decrease, the access to those resources decrease, are the least likely to make it. And so today I'm going to talk a little bit about some of the stuff that we did, some of the impact that we've seen on the state, and then some of the things that we will be doing in the future. So the first population that came to mind were people experiencing homelessness. And, as you know, people experiencing homelessness have a myriad of issues that they're facing. More often than not, these are individuals who have some pretty significant mental health issues and also may have some substance use issues, may have family issues, may almost always have really, really significant histories of trauma. And for some people, this is a chronic way of being for them, and for some people, this is the first time in their life that they've experienced homelessness. But what we knew was that in order to kind of curb the spread of COVID, all of our agencies and our partners that help serve people experiencing homelessness had to decrease the amount of people that they had in their walls, right? For those of you that have ever been to a homeless shelter, more often than not, it's kind of group living. It's bunk beds, a bunch of bunk beds in a room, or cots, or things like that. Not able to be the same way it was, right, for this population. So the first thing that we did was we rushed to put together and to piece together these safe recovery sites for people experiencing homelessness. And we started making phone calls to hotels all around. We started in Indianapolis, all around the city. And if you would have heard some of the responses we got, because we called up these hotels and were like, hey, we've got an idea for you. And then when we told it to them, they're like, this doesn't sound great. But what we did was we finally found a consortium of hotels, and it was different hotel groups across the state that were willing to step up to the call and say, you know what we're going to do? We're going to let you rent out our hotel for the foreseeable future. We are going to train our staff. We are going to bring in mental health providers and community partners, and we are going to be the ones who take the lead in serving this population. And so what they did was they opened up their hotel. We brought in our community mental health centers, some of our homeless serving agencies, and we created spots for people who were homeless or didn't have a safe place to quarantine, maybe because their family size or their home structure, people escaping domestic violence, people who were in residential substance use disorder treatment, to go to quarantine safely, where they would have 3 hot meals. They would be able to have telehealth video services for or mental health or case management, and they could safely quarantine and then be discharged to somewhere where they would also be safe afterwards, rather than having to be on the street, likely dying from this illness for people that had a lot of comorbid medical conditions, and be able to be connected, ideally connected with more resources than they came to us with, and safe and healthy, and having had an opportunity to recover from COVID. We ended up with 11 total sites, and we had served close to, I think, 1,500 people in that time frame. We currently are winding down, so we have a couple of sites remaining, and we have the mobility that if there is, God forbid, some sort of a resurgence or anything like that, that we can activate again. And they were in Indianapolis, Bloomington, Valparaiso, and Clarksville were our final 4 where the need was the greatest. So that was one of the cool things we were able to do. Those of you that are in the mental health world, you know that we also very quickly flipped all the switches, which I had no idea where these switches were. I had only been in this role 6 months prior to COVID hitting, and so I had like barely figured out where the bathroom was. And then I had a global pandemic on my hands, and I was like, okay, well, I guess we'll figure this out. The other thing that we did that was really, really phenomenal was being able to offer the ability to quickly expand the use of telehealth. And in these conversations, we quickly understood that video therapy is wonderful, and that will help break down a lot of barriers. But for a lot of people, especially in our rural communities, internet accessibility is pretty limited. And then for people that may not have had a lot of exposure to technology. There's a lot of people, especially in our rural areas, that prefer not to have the internet and still use a flip phone. And we weren't about to say, all right, you all, sorry about you, you don't get treatment. And so what we did was we flipped the switch, and we saw our telehealth needs skyrocket. And what was really, really, really cool about that is it started breaking down barriers to access to care. And so as you shared, the incredible pressure on our mental health and substance use disorder providers has been like that across the board. We are seeing a surge of people needing services like we have never seen before in our lives. We're seeing people with specific needs and from marginalized populations that want to work with people who have life experiences that are similar to them or perhaps look like them. And what we're able to see is now, because of telehealth, even if there aren't providers like that in your area, we can connect you via telehealth to somebody on the other side of the state that gets you to a level of that maybe somebody who was accessible near you couldn't before. And it has totally made us rethink the face and the functioning of mental health and substance use disorder services across the state of Indiana. Telehealth is here to stay, so we are continuing to work with it and look at how can it be best utilized, how can it be utilized within our community mental health systems. We've been working closely with the Department of Corrections to see how we can utilize that to make sure that people that are getting released are more quickly and more appropriately connected with the services that they need prior to getting out, so that they can be connected with their therapist while they are incarcerated, so that they have the same therapist when they leave, so that they're more likely to stick with the treatment that they need to be healthy. So talking about the impact that COVID has had on our mental health and our substance use disorder. So just as some frame of reference, I think we all feel this, right? We all are like, man, I bet mental health stuff is really serious right now. It seems like it's getting worse. And so to put some numbers on the kind of hunches that I think we all probably have had, we saw across the state at least a 50% increase in a crisis call. So we categorize a crisis call as somebody that's feeling suicidal, homicidal, like they might hurt themselves or somebody else, and on the verge of some sort of, as a person might call it, a breakdown. 211, which is our helpline, right? So you all know, most of you know, and if you don't, definitely get to know 211. So that's if I have any possible need, I call 211 and they know where in the state I can get help and what that looks like. And if that doesn't work, they got a backup of 4 or 5 different other agencies. They were seeing, on a typical day, typically about 1,000 calls a day. During the height of the pandemic, that increased to nearly 25,000 calls a day for people exactly as the people that went before me talked about, people in crisis about employment, about housing, about childcare, about their mental health, about their substance use. We saw an 81.5 increase in suicide text conversations and an 82% increase in unique texters compared to the year prior. Now, what's interesting about these suicide text hotlines, we saw these really skyrocket. And what we saw also was that the use of the text lines was predominantly from people that were about 21 years of age and younger, which means that we have younger people engaging in our mental health services more so than we have ever had in recorded history. We saw a 430% increase in calls related to domestic violence. We saw all kinds of things happening in the Department of Child Services system. There was a lot, when our schools shut down, kids that typically would have gotten reported to the school for safety sorts of issues, abuse issues, weren't seeing those mandated reporters anymore. And so then when the schools started opening back up, we just saw this surge that is really heartbreaking. Incredible increases in overdoses. Indiana, we have the 15th highest level of anxiety and depression in the entire country. So top 15, we made it. We in Morgan County, prior to the pandemic, so this was 2019, and I'm still waiting on getting some more updated data here. 2019, Morgan County had already seen a 59% increase in suicide deaths. That was prior to the pandemic. Right now, in the emergency department, the rates for people that are admitted due to thoughts of suicide or thoughts or acts of self-harm, in December 2019, it was about 15 people a month. It was 15 people a month in December of 2019. February 2021 saw an increase of that to 35 people, so about 2.5 times the amount of people. That's in a 1-month period, and that is given that all of the emergency department providers are coding these issues in a way that is congruent. And so, you know, if you've ever been in an emergency department, people present with usually a list of issues, right? And you have to pick the one that's the most significant. And so my guess is that those numbers are actually even a little bit higher than that. Another thing that we had to do, and that we did quickly was, and I know we all experienced this, was we had messages coming at us from every direction that were all telling us conflicting messages about what was COVID, what's gonna keep us safe, what do we do, who do we talk to, how isolated do we be, do we wear a mask, do we not wear a mask, like what in the world do we do? And we created the Be Well Indiana website. And so that was, and it's still up and running, and we have moved to we're starting to write some blogs and some things like that about how do we re-enter into society. And that is a curated list of all kinds of resources that you could possibly need. There's videos on there about how do I parent my child during this time? What do I tell them about what's happening in the world? How do I tell if I need help? What do I do if I think that one of my family members or loved ones need help? How do I know what information's out there and what information to trust? On there too, there is a really cool thing that you can click where you can take a self-assessment in a whole lot of categories that will tell you about various aspects of your mental health. I know for pretty much every person I've interacted with, myself included, there's been points during this pandemic that I'm like, whew, my mental health is having a hard time right now. And you can go on there and take an anxiety assessment and say, okay, am I just like being kind of am I having normal human anxiety responses, or is this something where maybe I could benefit from reaching out to a friend or a professional to try to get some help? We also launched the crisis counseling hotline through Be Well Indiana, and so this is something that we built into 211. And so any person at any time can call 211 and be connected with a trained counselor. It's free, it's totally anonymous, and you can talk to them as many times a week as you want to. They don't have to know who you are or where you're from. They don't bill your insurance. They don't call your employer. And they are there 24/7 to be able to just help us navigate the things that are going on. And if needed, because they are housed under that 211 umbrella, then get you connected with the resources that you need. And so what I really appreciated about my colleagues that spoke about the needs around housing and income stability is this idea of, I'm sure many of you have heard the phrase social determinants of health. And in psychology, so I'm also a licensed mental health and addictions counselor, and there's a theorist whose name was Maslow, and he had this hierarchy of needs that I'm sure a lot of you have heard of. And basically, to sum it up in a real layman's terms sort of way, if I have a client in my office and they're experiencing panic attacks, and I'm like, you know what, you just need to go home and just do some deep breathing. And they look at me and say, like, whatever, Rachel, I don't have a home. That's why I'm having the panic attacks. The deep breathing techniques, I could give them those all day long, but it's not going to make a difference, right? And so we really, really have to be looking at some of these things. So the Be Well Crisis Hotline, you can call and you can speak to a trained counselor 24/7. You can also speak to somebody who has lived experience in mental health or substance use disorder. This is another area that we have really, really been focused on. We call them peers, but those are essentially people with lived experience. And there is something very special if you are going through something, knowing somebody that says, hey, I've been in your shoes, look at me, I survived it, and here's my hand, I'm gonna help pull you through it, because you can make it too. And so through 211, you can be connected with a counselor or a peer. And then we also have expanded what are called our regional recovery hubs. And if you just get online and Google Regional Recovery Hubs Indiana, it will take you to everything that you need to know. But there are, I believe, 13 of these across the state. They are not affiliated with any particular community mental health center or insurance program or anything. They are a centralized location for people that have had mental health and substance use disorders to just come, get support, feel normal, feel like they might be able to make it, get some hope, get connected with treatment, and be able to leave that day and come back the next one if they so need to. So a couple of things to think about when we are talking about just the nature of the crisis that we're facing. What we're seeing through our crisis counseling program hotline through Be Well Indiana, housed under 211, is that about 44% of our callers have pre-existing trauma or substance abuse or mental health issues. About 60% are between the ages of 40 and 64. A quarter of them are between 18 and 39. Most people are calling because, number one, 34% of them are feeling isolated and withdrawn and alone. 34% are having really significant issues with sleep. 32% are feeling anxious or fearful. A quarter are having trouble concentrating and making decisions. A quarter are having intrusive thoughts and images related to the anxiety that they're feeling. A quarter are having fatigue. A quarter are having sadness. 20% are experiencing hopelessness. And so when you think about risk for suicide, hopelessness is the biggest predictor that somebody will attempt and complete a suicide. It's hopelessness. And to hear that 20% of our callers are experiencing that, that's nearly 1 in 5, right? That's a lot of people who feel like they don't have hope. And hope can come in a lot of forms, right? It can come from a friend, a colleague, a pastor, a counselor. It can come from being a recipient of a grant that helps you understand that you and your kids are not going to be homeless, right? There are so many ways that we can come together and instill hope in the people of our community. Another thing to think about in terms of suicide prevention that is really important to know is there is a misunderstanding. So a lot of people, if I were to say this, I'm going to say this, and it's okay if you get it wrong because it'll just really enhance my point. So feel free to get it wrong if you want to. What time of the year do you think people are most likely to consider or attempt suicide? What do people say? Winter. Almost everyone thinks it's winter or the holidays. So if you did think that, you're in good company. The truth is, it's almost that May, the month of May, is the highest month for suicide attempts. Now people ask, people are like, why? The suicide, the family, like all that stuff. May is because in the wintertime, we know, we have things to attribute our sadness to, right? We're like, oh, it's dark all the time, it's cold, I'm isolated, my family's awful, whatever it might be. And we're like, okay, I just gotta make it to the spring and then things will feel better. The problem is, if you are a person who's living with very real depression, you make it to the spring, the days are longer, things should be feeling better for you and they're not. And then with the emergence of spring often comes a burst of energy as well. What you will find is, I'm still sad. I've been thinking about hurting myself for months, and now I have the energy to do it. And so I say that to draw a parallel to where we are as a society coming out of this pandemic, right? During the pandemic, we all had a rationale for why maybe we were feeling a little bit more depressed or a little bit more anxious. When we are coming out of the pandemic, things are fine now, right? And for those of us that have been in survival mode, this is the time that we will see the repercussions of the survival mode. Mental health crisis often comes after survival mode. And that's something that's very difficult for people to understand, is the people will come and say, I'm fine now. Why am I more depressed than I was when all of that was happening? And it's because your body isn't having to survive anymore. And so all of this stuff that has been dammed up over here is finally broken down and hits you like a ton of bricks. And this is what we have to be watching for, preparing for, caring about, and taking action about in our community. And what I would encourage everyone to do is language matters, right? And I would encourage you to change your language to, it's not if your mental health has been impacted by everything that has happened during the pandemic, it's how, right? It's not if, it's how. We've all been impacted. We all have had days. I have yet to find, I guess I will say, I have yet to find a person that can truthfully look me in the eye and say, no, I've actually doing better than ever in terms of my mental health after the pandemic. And to normalize that, right? Because if I'm a person that's normalizing that, people are gonna come to me and tell me that they are struggling. And there is no better gift than a person coming to you and trusting you with information like that. And another thing to think about as we talk about all of these things is, I learned this, my first ever clinical experience was in a women's prison. And the first thing that I noticed when I was in there was this idea, have you all heard the phrase, there but by the grace of God go I? And as I reflect on my own life, had I made one or two decisions slightly differently, or had one or two people catch me doing the XYZ thing that I shouldn't have been doing, the entire trajectory of my life would have been different, right? And for people in our lives, sometimes it's not a fact that they made bad choices, it's that they didn't have good choices to make. And these are things to be thinking about. How can we as a community come together to make sure that people that need help have good choices on their menu that they can choose from? Because in a lot of places, that's not necessarily the case. So as we are talking about what we are hoping to do in the future, so we are fortunate at the Division of Mental Health and Addiction and fortunate and overwhelmed to have this incredible deluge of funding that has come our way. And we are very quickly working with so many community partners and so many experts on what do we need to do and what does this need to look like to make the biggest impact in our community. So some things that we are considering, and we're still working on finalizing it and everything approved, and as you all know, the state moves at a glacial speed, but we're pushing hard. The first thing is to create bridges, not cliffs. So how do we do things that have lasting impacts? And so a big thing that we discovered during COVID is that at the state, we need to do better in terms of data tracking, outcome tracking, and helping have our funding make sure that it's working by collecting the information that we need in a way that doesn't get in the way of the work and ridiculously increase administrative burden. So how are we making sure that what we think we're doing, we are doing, and that it is effective? Promoting evidence-based practices, emphasis on recovery support, so the social determinants of health that I mentioned earlier. The director, Jay Chaudhry, his recent catchphrase is, recovery is easier when life is. And boy, if that isn't the truth. Increasing equity, and so what we found during the pandemic is if we weren't careful, the quick fixes we put in place, the same people that always had access to services and programs and things like that just had easier access, and the people that had limited access were even further away than before, and we had to be really careful to be paying attention to that. And transparency, and so we want to be able to create a system where we're tracking things so closely that at any time that anybody asks, it says, hey, what'd you do with that 75 cents over here, and what was the outcome of it, that we're able to tell that to anybody that needs to know, and that we're able to share models and ideas and pilots, not only in our state, but across the country. The priority areas that we're focusing on, first and foremost, are prevention. So if you think about, you all know about the opiate epidemic. For those of us that were in the field, and so the 5 years prior to the opiate epidemic, I was a therapist. I was working in direct care. When the opiate epidemic hit, I was not surprised. We saw it coming. If you were working in the field, we're like, oh my gosh, this is surging, it's spiking. And I remember saying, why isn't there any funding to do anything about this? And so we are really, really trying to focus on how do we create a system that values prevention, that when we detect children that have traumatic events, how do we intervene with them early and appropriately, with them and their family, in a way that isn't threatening, but is driven by them and offers them the help that they feel like they need in a way that doesn't feel scary. Treatment and intervention, being mindful of cliffs, right? We don't want to create programs that people are feeling carried by, and then all of a sudden at month 18 and one day, it's no longer there, and then too bad, I hope you make it. Recovery supports, criminal justice system linkages, crisis and mobile crisis. You will be seeing a lot about that in the next coming year. There was a federal mandate recently that basically every state is moving to this 988 model, which is essentially 911 for crisis and suicide. And so we as a state right now are working on building our infrastructure to support that, as well as supporting community-based crisis centers and mobile crisis units. So in our communities, very unfortunately, often our law enforcement officers are the ones that are on the front line of many of our mental health crises. And despite their best efforts to de-escalate and the trainings and things that they go through, they are not therapists, and mental health is not their area of expertise. And so what we can do to work alongside our law enforcement partners to say, how can we come and be helpful in mental health crises so that we can get people connected with services and you can be on your way to deal with the things that are a better fit for your training. That's what we want to do. Workforce development, there is a critical shortage of mental health professionals in the state of Indiana, and we have to be very serious about attacking this from every angle. We have to be recruiting at the middle school, high school, undergraduate levels. We have to be working with people that are already in the field, or already educated and have their degrees to consider going back and taking a couple classes. We have to think about things like loan forgiveness programs, do whatever we can do to get people in the field, because the workforce shortage is phenomenal, and it is a huge barrier. And extend and expand the things that we have seen be successful during COVID, which include the Be Well Crisis Hotline and the regional recovery hubs that I mentioned before. And I think the biggest thing to really think about is we all are in a spot where and this is part of healing from a trauma and a collective trauma, is there is grief associated, as you mentioned, with this idea that I'm not going to be the same Rachel that I was pre-pandemic. A lot of times we think of healing as like getting back to who I was, but really what healing is a development of an identity that is a new normal, right? And so thinking about what we are on the precipice of a definition and a reinvention of ourselves and our communities. And so what is the new normal that we want our community to be defined by and to stand for? And I think that's why we all are here today. So with that, I thank you so much. I'm so excited to be here and to hear what comes of this. And I appreciate each and every one of you for your passion and your investment in these issues. So thank you.